Today we're here as part of the campaign to put pressure on the Senate to block these horrible changes, proposed changes to Medicare. In a nutshell, they want you, me, the user to pay. And we're here to say no to that. Keep it publicly funded. Now, it's not free. We must remember it's not free. We pay Medicare levy, we pay taxation, and it works. The system works.
About $1.6 billion being cut out of health in New South Wales alone. $50 billion around the country. It's, nurses are under pressure. A $7 so-called co-payment, which is simply a $7 tax. Every time you go to the doctor is only the start.
Every year, every 2 years, they'll move it up from $7 to $10 to $15 until Australians too have to begin making those fearful decisions.
My reason for wanting to save Medicare is that getting access to a doctor and health should not depend on your bank balance. It's a fundamental principle of being Australian.
Nurses know that this increased cost will impact disproportionately on vulnerable groups in our society. We fear the plan is to create a two-tiered health system similar to what operates in the USA. Lately, our Prime Minister talks a lot of Team Australia, but in healthcare, there will be two teams. One team will be covered by expensive private insurance. The other will have to make do with a second-class, underfunded health system.
And I am just so thankful that we have the health system we do. I think we have to fight to save what is a system that supports everyone.
Let us all fight for Medicare!
Tony Abbott, hear us say Medicare! Tony Abbott, hear us say Medicare!
We have an important message to send to Mr. Abbott and Mr. Baird today. Hands off Medicare and keep our public system public. We stand up to defend and protect Medicare and the principles of healthcare being a right, not a privilege. Co-payments would result in decreased access to healthcare and people delaying treatments, leading to higher healthcare costs overall.
As an old age pensioner, I cannot afford the premiums or the gap that is paid when you do have membership. Medicare has been the envy of the world, and I remember it was a gift to us from a former Labor government. And I'm here today to plead with you, Mr. Abbott, to please give our country back to us.
Not only do they want a co-payment, they want to privatise the payment systems. And any fool can rip something down. Any fool can destroy something and try and burn something down. It takes courage and strength and intelligence to build.
Tony Abbott, hear us say co-payment!
We don't like our public health system because it keeps us healthy and it does so incredibly cheaply. We spend 9% of our GDP on health. The United States, that these characters so want us to become, spends 18% of their GDP. For half the price, we get twice the help. There is no budget emergency and there is no health budget emergency. What is happening here is an arrow right at the heart of everything that is good and decent about Australia and its future.
Tony might want us all to be on Team Australia, but he ought to get the direction right. We have to tell the Abbott government to get its hands off our universal healthcare insurance system. Medicare is not in crisis. It works well. We have complementary private health systems that work alongside our public health system. We don't need to destroy our healthcare system.